Welcome to Tucker Carlson Today. So in the U.S., we don't talk a lot about vaccines. That debate seems to have kind of ended, but the data continue to pour in, and some of them are very troubling, and it's hard to make sense of them. In this country, there have been a few prominent physicians to weigh in on the topic of what we're seeing, but not enough to break through the media blockade against anyone who questions received wisdom on the matter of vaccines. But in the UK, something really interesting has happened. One of that country's top cardiologists and best-known cardiologists, Dr. Aseem Malhotra, went from promoting the vaccine on television to questioning the physical effects on healthy people of the vaccine. And that change came after his own father passed away unexpectedly. So this is an incredibly interesting story that has implications probably for every person watching this. And so we are honored to have that doctor join us now. Dr. Malhotra, thank you very much.
Thank you, Tucker.
So can you just root us in your story for just a moment? Where are you from? What have you spent the last 25 years doing, et cetera?
Yeah. So I grew up in Manchester, in England.
Yep.
And I went to medical school in Edinburgh, in Scotland. And then for the last 14 years or so, I've been practicing cardiology and worked as a cardiologist in London.
Yes.
And in that time, over, say, the last 10 years, I've done a lot of research on looking into the causes of how heart disease develops and shifting the paradigm, the understanding of heart disease. Focus a lot on lifestyle, but in that process, Tucker, I have realized that a lot of the information that doctors receive when it comes to clinical decision-making has been corrupted by vested interests, in particular big pharma in this particular discussion. But interestingly, at the very beginning of
I'm sorry to interrupt.
Yeah.
First of all, it's interesting to hear a practicing physician say that. And I should also tell our viewers that you've been involved in discussions about public health in Great Britain, not even just about cardiology, but about obesity and lifestyle, as you said. So you've looked at this carefully. When did you conclude that pharma or these organized interests were affecting medical decisions?
Yeah, it's a great question. So I qualified as a doctor in 2001. So I've been a practicing doctor for over 20 years. And what I noticed working in the National Health Service, Tucker, over many years, was more and more people were coming in with chronic diseases, multiple conditions. They weren't getting better. At the same time, we're hearing global news from the WHO in 2004 about obesity being a global pandemic. And I tried to then understand what was going on. And for me, certainly about 10, 12 years ago, I looked at the situation and thought, if we don't get on top of this, our healthcare systems are going to collapse. So we're already under a lot of pressure. So I started to investigate what was going on. And for me as a cardiologist, my primary interest was in heart disease. And despite all of so-called modern science, we'd never really made big inroads into tackling heart disease or certainly eradicating it. So my original research was to look into the heart disease issue, and in that process, I learned very quickly that the original paradigm around high cholesterol and the prescription of statin drugs, which is one of the most lucrative drugs in the history of medicine, was based upon very flawed science.
Wait a second. This is off topic, but I'm just interested. I thought statin drugs fixed heart disease.
Well, it's a really good question. So when one looks at statins, you need to understand what your benefit is. So people are under the impression they're a miracle drug. That's a way to prevent heart disease.
That was my impression, yeah.
What I did was looked at the data and broke it down in a way that is easily understandable for people. So, for example, Tucker, most people taking statins, and it's estimated almost 1 billion people are prescribed statins globally now. It's a huge industry. Most people who take statins are taking it for prevention of heart attacks.
Right.
But even when you look at that data, which is mostly industry-sponsored data, so let's just, if we accept that as gospel truth, although it's probably biased, for an individual taking a statin, their benefit in preventing a heart attack, Tucker, is about 1%, 1 in 100. So if you came to me and you said, Doc, I'm thinking about taking a statin, I don't have heart disease, but I think it might prevent one, I will say, Tucker, okay, let's discuss it. And then I will tell you this information and then help you make an informed decision. You might look at that and think, 1%? That doesn't sound that great. I think I'll try something else, like lifestyle or diet or whatever. So that's what I published on. And over the years...
1%?
Yeah, something about 1% benefit. And if you've had a heart attack, it's about 1 in 40 in preventing a further heart attack, right, over a 5-year period, and 1 in 83 in prolonging your life. So what I wanted to do is cut through the misinformation. So we have informed discussions with patients.
Well, I hope there are no downsides to statin drugs if 1 billion people are taking them.
Well, nothing serious, but things that interfere with the quality of life. And of course, a lot of what we do as doctors is to relieve suffering and improve people's quality of life. So maybe it varies. Estimates from 10 to maybe 40% of people at some point taking a statin will have symptoms which are most common, like fatigue, muscle aches, that interferes with the quality of their life. And that's when you have the discussion with the patient, say, listen, I want you to know that this is a benefit for you potentially, but if you stop the statin and say, I don't know, decide to eat real food and do a bit of exercise and get better sleep, you're probably going to be in a much better position in preventing a heart attack, because 80% of heart disease, Tucker, is purely lifestyle and environment related.
Well, that is not at all the story I was told, at all. That's interesting. So that'd be a whole different fascinating segment. But so watching that, coming to that conclusion, is that what convinced you that maybe our perceptions are shaped by the drug companies?
Yeah, if the most prescribed drug and thought to be one of the most effective drugs in the history of medicine was actually not that great, the benefits are marginal, it got me to investigate further into the whole of the medical industrial complex. And then